Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you very much for joining us.
Well, thank you very much for having me on your program.
Yes, sir. No, last week you addressed vaccine. You have been speaking about that. Just for a matter of clarity, Guyana will be able to access any vaccine that comes on board. Could you just give us a little bit about that?
Yeah, well, there are several mechanisms that we are pursuing. The major one is a financing mechanism called COVAX. This body is made up of a number of organizations, including the World Health Organization, CEPI, Gavi, to name the three main players. And they have come together, pool their resources and skills to create this platform to allow people to access vaccines. They intend to procure 2 billion doses of vaccines. The challenge, however, is that vaccines are now, some of them are now in the phase 3 trial, which means after the trial, then we'll know which one would be effective. But what COVAX facility has been doing is, even while they're in phase 3 trials, is paying for some manufacturers to proceed with the manufacturing of these vaccines in the hope that as soon as they get positive results from those that they're using right now in trials, whichever one shows positive results, that they can scale up the manufacturing very quickly. So COVAX is really about countries pooling their financial resources so that they can pay for the research and the manufacturing of these vaccines. Guyana has indicated to the COVAX mechanism that we want to be part of this. So whatever vaccine they are able to research and manufacture, that we would benefit from that vaccine. We have signed all the letters to COVAX. That has been sent almost maybe about a month and a half ago, and we have met those requirements. So we are now part of the COVAX mechanism. COVAX also then sent out to all the countries to ask them to make an upfront payment. So if you are going to acquire vaccines for 50% of your population, then you need to pay COVAX for 50% of the vaccines. At least a portion of that you must pay. We, however, have been able to benefit under a different scheme. So we were not required to pay because there are 10 countries in the Caribbean that Gavi is going to pay for. And they're going to take care of our initial costs for vaccines. And so we were not required to pay. And, but we will still get vaccines. Now, many other countries in the Caribbean are not going to benefit from this, and therefore they would have to pay. And you would have seen recently that CARFA would have put out a statement to say that they have received funding from the European Union and that they are going to use that funding to pay COVAX to acquire 1 million doses of vaccines for countries in the Caribbean. So since we are already getting ours free, you know, CARFA is going to help other countries that have to pay for theirs. And that is why I think there was some discussion going on in the media to find out why is it that Guyana is a member of CARFA, but Guyana probably is not getting any, or was not listed on the CARFA to get vaccines. The simple reason is that we are already getting ours free, and therefore CARFA would want to give to other countries that would have had to pay. So I think that would maybe clarify that matter that was in some people's mind. In addition, though, we are already seeing that there's a rollout of the vaccine. Last week, we have seen in China that the Chinese have started to immunize their population, and and we'll see how that rollout goes. There are other vaccine platforms that are available, and we have engaged in talks with some of those countries. And we, again, will await until the phase 3 trials are over so that we can make a decision on whether we will want this vaccine versus that vaccine. In addition to all of that, um, we are also going to be part of the WHO vaccine trials. There's a program on the WHO where you can get um, advanced vaccines, so to speak. We have indicated an interest that we would like to be part of the Solidarity trial. And so WHO has asked us to identify a focal point in Guyana, which we have already done. And they would be in contact with that focal point to see how we would probably start rolling out the initial vaccine. So even before we get to COVAX and before we get vaccines from COVAX, there is that possibility that Guyana would get some advanced vaccines to see how it works in Guyana in this setting. So that is something that we've been pursuing, and as we get more information, we'll update the public.
All right, Minister, two things from that. Just to reiterate, there are other avenues that Ghana, I remember you saying we were going to get some assistance from Argentina.
Right, so we're working with Argentina as one possible area where we can get vaccines. The Argentinians are manufacturing 250 million doses, and there's a possibility for us to get from them. We have spoken to the government of India. They're doing 1 billion doses. There's a possibility of getting from them. The Russians are also doing their vaccine. There's a possibility of getting vaccines from them. And you have the Chinese, who have also been working on a vaccine that has started the rollout last week. And again, there is a possibility of getting vaccines from China. But we are extra cautious because we have in place expert committee, if you like, that would review the findings from the phase 3 trial. And of course, you have technical bodies such as the WHO, who have global experts that would verify the information and data coming out from these trials to ensure that whatever is given to people is safe and that it would work. So that's something that we are being very cautious. While we know that we want to exit the pandemic and the only way to exit it is probably through a vaccine, we want to ensure that once we introduce it, that it is something that is effective and safe for our population. So we'll ensure that stringent guidelines are in place before we actually introduce this vaccine.
Almost like you saw my question, because I was going to ask you, because there's still a lot of people who hear the word trial and they're a bit hesitant, thinking that it probably will just be something that you come and hand out, you know?
No. These things, even when you're going through the different levels of, with vaccines or with any medication, when you want to check the safety and efficacy, you go through different levels of trials or what we call clinical trials. So there's a phase 1, phase 2, phase 3 trial. And then when you pass the phase 3, then you would be able to give it to the general population. And in the developed countries, they have established very strong institutions that would monitor for the safety and efficacy of these products, and they would not allow any one of these things to be used in the public if it's not safe. We have had cases, even as these vaccines are being tested, where when they find any significant side effects, they actually shut down the entire trial. They investigate that case just to make sure that people are safe. So whatever is being done, people's safety is put foremost, and it is being, if there are any side effects at all, then they stop, they investigate, they try to understand why this or why that. In some cases, it's probably not even associated with the vaccine, but you need to investigate it and clear the air. And that's what has been happening over the last few months. So I'm very optimistic that with the many vaccines that are currently available, in fact, you have, the last count I saw was 204 different types of vaccines that are at various stages. Some are at preclinical trials, some are at phase 1, phase 2, some are at phase 3. You probably have about 9 or 10 at the phase 3 level. And all of those are being now properly evaluated before you introduce it into the general population. So I don't think people have anything to fear. What we need to do is, and that's going to be the challenge, because when these vaccines become available, not everyone would be able to access a vaccine. So that's going to be a challenge, and it will take some time before you're able to ramp up so that you can produce enough vaccines for everyone in the world.
All right, Minister, we're talking about remdesivir. All right, so you were initially telling me that there's a pre-published something that can happen before an actual study.
Yeah, these papers are called preprints, which means that they are published before the peer review. And so WHO has done a preprint with the initial results, and we'll see after it has been reviewed by scientific peers whether or not those results would be validated. So we'll see. We have been able to calibrate our guidelines based on international best practices and the information that we are garnering from scientific studies. And we will adjust accordingly as we get more scientific information. So if it is that remdesivir is ineffective, well then at some point we'll remove that from our treatment protocols.
All right, if I can ask you, what is our treatment like right now as it is in our hospital?
The treatment, you have persons when they're infected would probably be at different stages. So one stage might be persons who are asymptomatic or pre-symptomatic, meaning they have no signs or symptoms of the disease, but they are positive. Then you have a mild form of COVID. The mild form means that they might have some of the signs and symptoms, things like a cough or fever, headache or malaise or body ache. Some people would have challenges with smelling. They can't smell, they can't taste. So those are typical signs. But what those people in the mild form would not have is really they don't have any problems breathing. You have a moderate stage where people would have all those symptoms, but then they have difficulty breathing. And then you have this severe form of COVID, which would require hospitalization, and that is because they're having some severe challenges breathing. In some cases, based on the assessments that would have been done, we look at what is going on with their lungs to see how functional the lungs are, and we'll make an assessment. So once we make that assessment, in some cases, we'll have to provide ventilation. We have various forms of ventilation that we can give, but this is basically getting oxygen into the person's lung. One of the challenges that we had in the past was not having enough ventilators to do so. now we have an adequate supply of ventilators in our ICU. So whoever needs ventilation or ventilatory care can be provided with such care. Now, as you progress from maybe moderate to severe forms of the disease, there are things that happen within the body. And one of that is your body basically trying to fight off the disease. But sometimes the body can go into an overreaction, and that is referred to as a cytokine storm. And people who exhibit that can end up in some more complications. So there are medications that one can use to mitigate that. We have those medications available. So these are to mitigate some of the processes that are happening within the body. To fight off the actual virus, that is where things like remdesivir and so would come in to prevent the replication of the virus. Because remdesivir is an antiviral medication, and the understanding was that this would interrupt the life cycle of the virus. So we are approaching the problem from different aspects, and a combination of these medications should help the patient to get better. Now, some people would progress from severe to critical, and in a critical stage, a lot of these patients probably would have other malfunctions in their body. So you can have respiratory failure, which means that the lungs is no longer working, and various organs of the body can shut down. So that's really, really critical. And we have seen such patients, but a lot of those patients that we get are really patients who had underlying morbidities. So meaning that they had other illnesses. We have seen a lot of people who had type 2 diabetes. When they come into the system, and if the diabetes is not controlled, then they can easily move from moderate to severe to critical forms of COVID-19. So this is something that we have to guard against. We have probably about 60,000 people with diabetes in Guyana, so which means that these 60,000 people potentially are very vulnerable. They have increased risk. And therefore, we are urging that those persons take additional precautions to protect themselves. They can do so by making sure that they are controlling their diabetes, and they can also do so by making sure that they take all the preventative measures that we have been speaking about. The other category of persons that we see outside of diabetics, we have seen a lot of people with cardiovascular diseases, meaning heart problems. And if they're not controlling those heart conditions with proper medication, they can be placed more at risk for COVID-19. Cancer patients are also at risk. And we have also seen persons with kidney diseases, whether in acute kidney infections or end-stage renal diseases. So both of them can create complications for patients, and we have seen that in the mortality profile with the deaths that we have had so far. In addition to that, people whose immune system has been compromised because of diseases such as HIV, they too sometimes can pose severe challenge for us to manage. So again, all these categories of people who would have comorbidities, underlying disease, existing disease, we are really asking them to be extra cautious, make sure they use their medication, and make sure that they stay out of harm's way, so to speak. Do all the protocols to ensure that you're not putting yourself at risk for COVID-19. So we have an expert team of doctors at the Georgetown Hospital, and we have trained a lot of people across the regional system to be able to manage the patients appropriately, and they have been doing that. And we have constantly been trying to get appropriate medication, get the appropriate equipment and consumables needed so that they can do their jobs better. So this is an ongoing process. And as we learn more about other medications that are coming on stream, we are also working to acquire those types of medication. You would also recall that convalescent plasma has been used in some parts of the world, and it has been shown to be effective for some patients. We have been able to identify patients who have recovered, and we have harvested their plasma, and we are using that plasma on sick patients as well. So we are doing almost everything that treatment protocols in any part of the world. We are using similar techniques here, and whatever is available in another part of the world, we are trying to have those techniques here, and those medication or things like convalescent plasma available so that our doctors can treat the patients with the best that is available currently. What we don't have right now is things like the monoclonal antibodies. I think that has been made popular by the recent treatment of President Trump, but those are very expensive, and we don't have that in Guyana.
Okay, sir. Just to wrap up now, how has COVID curb been going, and is there plans to extend it?
COVID curb has, I think, in my mind, been going very well. We have been able to reach a lot more people and talk to them. So I think in terms of lifting awareness, it is doing a phenomenal job because we have been out in almost every community now. What we have to keep doing is reinforce that message, and we need more local people to take on the job of spreading the message, spreading the right messages, because sometimes there are a lot of people who mislead others, especially on social media. So we have to guard against misleading information, and we want people to spread the right message. And once we can all become part of this education mission, every single Guyanese should be part of this, trying to help each other out by teaching each other about COVID-19, how we can prevent it, and to ensure that we are taking those measures. Once we do that, we'll be safe.
Yes, sir. That's it for today's COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms. Thank you.